The ankle joint is between the ankle mortise, which is the inferior part of the tibia and the fibula, which is concave, and the talus, which is convex. So here the convex surface moves on the concave surface. The anterior part of the talus is more wider compared to the posterior part. Posterior part is narrow. Therefore, during dorsiflexion, the wider part is getting accommodated in the ankle mortise. Therefore, dorsiflexion, the foot is more stable. Whereas in plantar flexion, the posterior part, which is narrow, is accommodating in a more larger space of the ankle mortise. Therefore, injuries are more common in the plantar flexion. Because the talus is convex, whenever there is stiffness at the ankle joint, at first we should mobilize for the inferior tibiofibular joint. So we have anterior to posterior glide, posterior to anterior glide, we have cephalic glide, and we have the caudate glide. Tibiofibular joint should be mobilized first, and then for the ankle joint, for dorsiflexion, we must give anterior to posterior glide, and for plantar flexion, we must give posterior to anterior glide. Dorsiflexion, anterior to posterior glide, plantar flexion, posterior to anterior glide. In the lateral aspect of the foot, when we palpate antero-posterior, we can appreciate or we can palpate for one prominent area. That prominent area is the tubercle of the fifth metatarsal. Immediate posterior to the tubercle, we can find for one gap, and that gap corresponds to the cuboid. Once we palpate for the cuboid, we can apply dorsoventral glide, and we can apply the ventrodorsal glide from the ventral aspect dorsally, and from the dorsal aspect ventrally we can apply dorsoventral glide. In the medial aspect, keeping the foot in the neutral position, when we palpate 1 inch inferior and 1 inch anterior, we can palpate for the navicular tubercle. Palpating for the navicular tubercle, we can apply ventrodorsal glide and dorsoventral glide with the grades. The base of the first metatarsal corresponds to the medial cuneiform. The base of the second metatarsal corresponds to the intermediate cuneiform. Base of the third metatarsal corresponds to the lateral cuneiform. Fourth and fifth metatarsal base corresponds to the cuboid. So we can palpate for the cuneiform and we can give dorsoventral glides for medial, intermediate, and for the lateral. Cuboid we have already discussed. As far as the metatarsophalangeal joints are concerned, the proximal articulating surface of the phalanx is concave. So in order to increase the flexion, we must give dorsoventral glides. For increasing extension, we must give ventrodorsal glides. For MTP, for PIP and for DIP, the proximal articulating surface is always convex, the distal articulating surface is always concave. So here the concave rule is applicable. To increase the flexion, dorsoventral glide, and to increase extension, ventrodorsal glides are given.